Welcome back to AHA TV. I'm Allison Godlove. Joining me now is Dr. Joanna Chikwe and Dr. Amit Khera. Thank you both for being here. Day 2, how was today?
Oh, it's absolutely great. Started off at 8 a.m. this morning with a fantastic New England Journal of Medicine session with the editor, the cardiovascular editor, and some really phenomenal presentations looking at the impactful research that's gone in there this year. And then towards the end of this afternoon, the presidential session.
Yeah.
Amazing. And first, boy, Dr. Churchwell, so inspiring. I really was amazing. And then, earlier today there was a Nobel session. And next door there was this GLP-1 main event, and I just had to go back and forth and back and forth. I just was conflicted, but it was pretty amazing. But Joe, I know we're going to talk about some late breakers, and there were some great surgical studies here as well, and I think you were involved in some of those. So tell me a little bit about some of the surgical trials.
Well, we got to hear about Nvalve, which is a fantastic study trying to understand what kind of anticoagulation patients should be on after they've had bioprosthetic valves. So 400 patients randomized after surgical aortic valve replacements with bioprosthesis to either Coumadin or NOAC, and essentially a non-inferiority finding. Both seem safe, and my guess would be that patients and their physicians will be very happy not to necessarily have to take Coumadin after aortic valve replacement.
That's a pretty big advance, right? To not, and you as a surgeon would know best. I mean, not to have to take warfarin with all the challenges with it. That's sort of an important finding, I think.
Absolutely. How about you? What was the trial that struck you?
Well, I gravitate towards the prevention ones, and we had this great one. I had a couple of important ones. The first, topspin, like the name, by the way, but in India there's more than 300 million people that have hypertension. So this theme of hypertension started on day 1 in multiple studies here. And so what's the best way to treat individuals in India? It's not known, calcium channel blockers, ACE inhibitors, diuretics. There's so many choices, and so what's optimal? And it's a really important question given how many millions of people this affects. So, almost 2,000 people randomized to 3 different double combination pills. It turns out they all lowered by 14 millimeters of mercury. They all were pretty effective, and none was better than the other. And as the discussant said, it's an informative null because it says you have license to really use all 3 of these to really try to combat hypertension, which is a huge problem in India and around the world. So I think there was maybe some other things in your session too that were pretty exciting as well.
So remind me of this one. This one was Clear Synergy?
That was Clear Synergy,
so
I remember
this is
it. Yep.
Patients who had AMI that essentially got randomized to spironolactone or just optical medical therapy, and I think the thought was that it might reduce heart failure, which it did, but didn't actually make a difference at the primary endpoint, which I think was all-cause death, heart failure, and blanking on the final part of that composite endpoint.
But cardiovascular important.
Some really important.
But it was an null trial, I think, ultimately.
It was a huge trial, 7,000 patients. I think that one's in the New England Journal of Medicine.
That's right. Yeah, that's right. And then I guess the other part of that was at TCT not too long ago, where they had the colchicine, and that got published today, and we knew that was null. So unfortunate finding, but informative. Again, we want to know what we should give and what may not help, and so that we can minimize medicines that aren't that helpful for patients as well. I had a kind of another one I'd like to tell you about. That this one was really cool. When we were, if you remember, at our late breaking selection, we were really excited about this one, the My Heart trial. At AHA we think about global health, and we mentioned topspin, but pacemakers, something that you see all the time, I see all the time, and but in many low and middle income countries, they are incredibly expensive and inaccessible. And so this was one looking at a randomized trial, so good data about using a recycled pacemaker versus a new one with infection risk as the outcome, non-inferiority. That is incredibly important. I want to give kudos to the investigators. This was in Africa, in Mexico, in Central America, South America. So places where we'd love to see more trials coming out of them. And essentially these recycled pacemakers, non-inferior, really didn't see more infections or complications. So I think that gives a lot of leeway for folks now to be able to expand the use of pacemakers in a safe way and save a lot of money, frankly. So pretty neat day. And so you excited about tomorrow? It's the last day.
I will be sad that it's the last day, because it has just been a fantastic meeting, ton of energy, a lot of great sort of breakouts, ton of people coming together. Yeah, absolutely phenomenal.
Yeah, an exciting day today, exciting day tomorrow. We're looking forward to it, the final day. Well, thank you both for joining us.
Thank you.
It was great to have you here to talk about it. Thank you.
Thank you very much.
Yeah. AHA TV is supported by Novo Nordisk.